Senator from Indiana.
Thank you, Mr. President. I rise today to offer a motion that would protect Medicaid, the Medicaid expansion, and the Healthy Indiana Plan, known as HIP 2.0, in my home state of Indiana. I first want to thank my colleagues for their support of this motion. I'm proud to have Senators Casey, Cantwell, Blumenthal, Leahy, Brown, Harris, Hassan, Franken, Feinstein, Udall, Shaheen, Carper, Coons, Whitehouse, Kane, Van Hollen, Cortez Masto, Baldwin, Menendez, Reed, Duckworth, Manchin, Markey, Stabenow, Durbin, Wyden, Murphy, Warren, Gillibrand, Cardin, Klobuchar, Heinrich, Hirono, Booker, Peters, Warner, and Nelson as co-sponsors of this effort. I also want to extend a special thank you to my friend Senator Bob Casey of Pennsylvania. Senator Casey has been a tireless advocate for protecting the Medicaid program and the critical services that it provides, not just to the people of Pennsylvania, but to millions of Americans across our beloved country. Senator Casey has done incredible work to remind all Americans of the important role Medicaid plays in our communities and the millions of children, families, students, and seniors who have coverage through Medicaid. My motion is simple. It would send this bill back to the Finance Committee to get the consideration it never received. And it would require the committee to strike provisions that reduce or eliminate benefits for those currently eligible for Medicaid, prevent states from expanding Medicaid, or shift costs to states to cover that care. In my state of Indiana, we've seen the success of a bipartisan approach to expanding the Medicaid program and helping our fellow citizens access health insurance. I was proud to work with then Indiana Governor, now Vice President Mike Pence, when he used the Affordable Care Act to establish HIP 2.0. More than 400,000 Hoosiers have been able to access coverage through HIP 2.0. Many for the first time in their lives. HIP 2.0 has helped reduce the uninsured rate in Indiana by 30%. Our vice president called HIP 2.0, that's the Medicaid expansion in Indiana, a national model. Then Governor Pence is hardly the only Republican governor to praise the Medicaid expansion as a way to cover more of our citizens. Governor Sandoval of Nevada said just yesterday that he will continue to do all I can to protect the thousands of Nevadans whose lives are healthier and happier as a result of the expansion of Medicaid. Governor Kasich of Ohio has offered similar sentiments as he has fought to protect the Medicaid coverage for his state. And nationwide, 31 states and Washington, D.C. expanded coverage to more than 14 million Americans, many of whom have health insurance for the first time in their lives. All of that progress is at risk with the current bill. Many of our states, including Indiana, have been devastated by the opioid abuse and heroin use epidemics. This public health crisis hasn't been confined to simply one neighborhood or one economic bracket. It's been felt in communities across my state, all communities, and across our country. Vice President Pence said in his farewell address as governor that with HIP 2.0, we've made great strides expanding treatment for those who struggle in the grip of drug addiction. I agree with the Vice President. HIP 2.0 and the Medicaid expansion has made treatment and recovery services more accessible for thousands of Americans struggling with addiction as they work to get back on their feet. I don't think there's a single member of this entire body, the United States Senate, who hasn't heard from the relative of someone who's battling addiction or from someone who's lost a loved one due to this epidemic. Gutting Medicaid and ending programs like HIP 2.0 as we know it would not make life better for Hoosiers or for the other 14 million Americans that have gained coverage through the Medicaid expansion. It actually does the opposite. Too often this debate's been about statistics and not about the people who would be harmed. But healthcare at the end of every day is inherently personal. It's about the health and the economic well-being of our loved ones. It's about not having to go to the ER just to visit a doctor. It's about our financial security, so our families and our friends aren't one illness away from bankruptcy. The proposal before us wouldn't just impact Medicaid expansion. It would harm millions of working Americans who count on Medicaid for basic health care. It would affect more families than that, including those families who have insurance through their jobs, but also use Medicaid to access care for chronic or complex conditions. In 2015, 63% of Medicaid households had at least one full-time worker, and another 14% had part-time workers. It's almost 80%. For these hardworking Americans, Medicaid provides their family with financial security and stability, and the health care they need so they can keep working. Last month, I stood on this floor and shared the stories of Hoosiers, including those who have Medicaid themselves or to ensure that their children have the care they need. I've met with these families, heard their struggles, their fears, their pain, and listened as they pleaded with all of us here to protect their ability to access Medicaid. Many of these Hoosiers or their children are struggling with very complex medical needs that make it impossible for them to get coverage in the past, and who would be priced out of the market under this current legislation. I can't support a bill that takes care away from these families or from their children. My faith teaches me we're all God's children. Every man, woman, and child should have the chance to live up to their God-given potential. There's nothing we wouldn't do to take care of our kids. These aren't just Indiana values. These are values in every town, in every corner of our country. My faith also teaches me that we all deserve to live and work and retire with dignity. In Indiana, 62% of Hoosier nursing home residents, 62% use Medicaid to help pay for their care. According to the Kaiser Family Foundation, Medicaid supports more than 1.4 million Americans in nursing homes across our country. Their care would be threatened by this bill, which is part of why seniors groups have been so vocal in their opposition to the proposed Medicaid cuts in this bill. I've also heard from a number of school superintendents all across my state opposing the Medicaid cuts because of the harm it would have